You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. And again, an ad posted on social media reminds us who we're dealing with in the Oval Office right now.
It's midnight in Washington. The lights are finally going out in the Capitol after a long day in the impeachment trial of Donald J. Trump. You can't trust this president to do the right thing, not for 1 minute, not for one election, not for the sake of our country. You just can't. Bing, bing, bong, bong, bing, he will not change, and you know it. History will not be kind to Donald Trump. I think we all know that, not because it will be written by never-Trumpers, but because whenever we have departed from the values of our nation, we have come to regret it, and that regret is written all over the pages of our history. If you find that the House has proved its case and still vote to acquit, your name will be tied to his with a cord of steel and for all of history. He has betrayed our national security. He has compromised our elections, and he will do so again. You will not change him. You cannot constrain him. Truth matters little to him. What's right matters even less, and decency matters not at all. We have proven Donald Trump guilty. Now do impartial justice and convict him.
While we air that, well, Donald Trump is actually suing local TV stations for airing ads such as that because he doesn't want the people to actually see and know what he's actually done. As we've been saying on this show, the documented health disparities between racial groups in the U.S., including higher rates of chronic diseases and lower access to health care among blacks compared with whites, is making some African Americans more vulnerable to COVID-19. Joining me right now is Dr. Sidney Croupet, internal medicine physician and founder and CEO of Croupet Quality Clinic in Fort Lauderdale, Florida. And so, Dr. Croupet, you've been studying, working on these type of issues all across the world. And so, just what makes it different when it comes to African Americans? What's happening here?
Yeah, well, Roland, thank you so much for the opportunity and the platform to share with everyone. You know, as you know, health disparities is not something that's new to us. It's something that we've been dealing with for decades, actually. And we know a lot what's causing health disparities. And it's important for us to understand what health disparities is, because a lot of times we throw these sexy words out there and we just don't really get a good sense on what they are. But for me in the front lines, what that means is this, is that there are people who are dying, that there are a group of individuals, African Americans, for instance, and Latinos, they're dying more than their counterparts in the same situation. They're getting sick more than their counterparts in the same situation. And I'll give you an example. Someone with high blood pressure. We know that high blood pressure causes kidney disease, heart disease, strokes. And in the African American community, I mean, we're almost at 40% more likely to suffer from high blood pressure than our counterparts in America. So this is definitely something that's concerning. And so when you're looking at in the spectrum of the COVID-19 pandemic, all it does is it shines a light on the disparities that we have already had in our country. So for me, as a primary care doctor, and Roland, you know, I deal with this every day. The fact that I'm a Black physician in this community in itself is addressing health disparity, because I'm likely to provide the best care and the quality care for someone who looks like me. And studies have shown this already. And so there are other things that we need to look at in terms of addressing health disparities. But in the setting of COVID-19, the issue is that we expected to know that us in African-American community, as well as Latinos, we would probably be the ones suffering a lot more because of these existing health disparities and healthcare disparities in specifically, which is the services that's provided to them. And it's sad to say is that because of our race and ethnic background, it's proven that, you know, we don't get the best care that we deserve. And so when I hear about this health disparity discussion, it's a very complicated and complex conversation that requires a lot of different disciplines. But for a physician, I believe that what we can do is making sure that every single African American, Latino that comes to our office or I see in the office or in the hospital need to get the best care that they can get. And so, Roland, for me, health disparities is something that I think we can address. And that's the culprit on why a lot of our people are dying in the community from this COVID-19 infection. And a lot of them are getting more sick than they really need to be. And so when you have diseases such as obesity, high blood pressure, diabetes in our community, therefore, this put these people at higher risk of getting infected and worse, getting into severe illness with the infection.
Do you think, you heard Dr. Anthony Fauci, you heard the Surgeon General, Jerome Adams, you heard them talk last week. Do you actually think that this country has the guts to actually deal with this issue? It's no different than what we're seeing with what coronavirus is exposed to everybody when it comes to the gaps in our education system. It's no different than what we're seeing when it comes to people who are now depending upon essential workers who are not even getting paid a living wage. It's no different than what we're seeing when it comes to so many things that this coronavirus has shown us. Will this nation use this moment to deal with this issue? Do you actually have faith that leaders will?
Well, Roland, I have no choice but to have faith. Okay, I have no choice but to have faith. I mean, in fact, if we don't have faith, then there's no point. I do believe that this is an opportunity that we have. We have an opportunity to look at these disparities that we're noticing. We have an opportunity to look at the folks who are more vulnerable in these situations and to actually do something about them. I can tell you from where I stand, I try not to wait for others to do for us. We have to do for ourselves. And so for me, in my community here in Fort Lauderdale, we decided to take matters in our own hands. And we started our own task force to address where are the needs and where are the gaps around testing, around people getting the treatments that they need. And access to healthcare in general is a big issue in our country. There's a lot of people who are uninsured, people who don't have or underinsured, who don't have all the care that they need. And there are people who have, no documentation for them to even exist in our country so they can get the care they need. So there's a lot of issues in terms of accessing healthcare. So for us here, we decided to develop a membership model, which we call direct primary care. And this model gives people access to basic primary care that they need for them to live a quality life. And because I'm able to do that here in my small ecosystem, that's how we begin. And, previously the representative talked about communities, focusing on our communities. This is how we have to be able to win this game against health disparity and ultimately against COVID-19 pandemic, is to look at our communities. What are we doing? Supporting the folks down there in the front lines, either the local policymakers or local, health techs, doctors, nurses. We need to support them and looking at how they can better do their work more effectively and more efficiently. And if we do this one person at a time, one community at a time, I believe we can address health disparities. And as I mentioned before, here in Fort Lauderdale, we've been addressing this for quite some time. I've been working for over 10 years with an ethnically and linguistically diverse community here in Florida. And so to be able to support them in the way that I do, to provide them the quality level of care that they need and they deserve, this is exactly what we need more of in order for us to address this long term.
Well, and also what has to happen, this is the final point for you, what has to happen is you need nation's leaders listening to black doctors, listening to people who are quite familiar with this here. We had a doctor from Meharry on last week when Dr. Fauci said they were just learning that asthma was an underlying threat or condition for coronavirus. And we came back from the news conference and the doctor said, they could have asked any black doctor anywhere in America and they would have told him that. And this guy said, we've been yelling that for 5 weeks here in Nashville. He's like, maybe next time listen to a Meharry Medical School.
You know something, Roland? Great point. One of my theories is that I don't speak to people who don't have skin in the game, right? So these folks who go up there and theorize and give them their opinions, that's fine. But for right now, I can tell you, your platform is giving us an opportunity to share, an opportunity to speak up. Because what's happening as practitioners, we're the ones that have the unique perspective that will eventually address some of these concerns and these gaps that exist. And so, absolutely, I think, you could ask any Black doctor working in a diverse community will tell you asthma, high blood pressure, diabetes, those are the things that's running rampant. And one last thing, when you think about prevention and when you hear data such as, close to 30%, over 30% of Black women die from breast cancer more than white women do. That's staggering. That's disturbing for a doctor, for someone who's in healthcare. And so what can I do? And what I've done for that is that I've screened all the Black women in my practices. So these are some of the things that I can do in my ecosystem. But again, Roland, as you previously alluded to, this problem of health disparity, it requires multiple disciplines, requires policymakers, requires business folks. We all need to work together as a multidisciplinary unit in order for us to address this. But again, we need to start somewhere. And if everyone does their part and you create these platforms for us to speak up in what we see in the front lines, and this is how I think ultimately we will win this game against health disparity.
Well, Dr. Croupet, we probably had in the last 5 weeks some 60 different guests on this show. Nearly all of them have been African-American. Y'all are not hard to find. I have no idea why MSNBC, CNN, Fox News, ABC, NBC, CBS, and the rest of these people seem to make it so hard. But when the White House last week talked about what's happening with the Black people, and then when the New York Times put it on the front page, it was real easy to find Black doctors. Part of that, and let's just call it what it is, part of that also deals with the bigotry and the racism that exists in mainstream media, where they only see us when it's a Black story, but they don't think to actually have Black experts who could have been talking about these things, because y'all can also still talk about just stuff beyond Black people. I mean, the body is the body, health is health. And I think had mainstream media done that, it would have heard African-American physicians and doctors and scientists raising these issues in February and March and not waiting for a White House news conference in April. That's
Roland, great point. And I have to tell you, and I'll share this personal story about me, for instance. I'm Haitian American. Mm-hmm. I was born in Brooklyn, New York, by Haitian immigrants. My parents sacrificed their entire life to give me and my family, my brothers and sister, a great education in America. And I've devoted my entire career in terms of believing in creating a possibility that did not exist from my lens, which is that everyone deserves quality care no matter where they live. And that is where I stand. And so you can tell based on my track record and everything that I've done, I've studied and I've got a public health degree, I have health policy degrees. I've educated myself appropriately to understand the issues. And so absolutely, I can certainly talk about the issues from different perspectives. But again, I think this is about humanity. And if we cannot address issues about humanity and identifying people for who they are in terms of what they can bring into the conversation without actually identifying them with a race or an ethnic group, I think we could probably do ourselves a favor. And so I absolutely agree with you, Roland. I think you made a very good point. I think we need to look at what is the issues around why isn't there a representative or of the people that look like us. And as a doctor, I'm a role model. I remember going back to Erasmus High School in Brooklyn, New York, speaking to the kids there and letting them know that they too can become a doctor. And so as a role model, it's important for me to be visible. And again, I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having, Roland.
Well, that's why we do it. Dr. Croupet, we certainly appreciate you joining us. Thanks a lot.
Absolutely. Thank you.
All right. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.